Have you had bunion surgery? Are you walking or running and wearing the shoes you prefer? If not, I have some tips for you. After surgery, one of the most important things to walk without a limp is rolling over your toes during walking. In order to do this, you need 60 degrees of dorsiflexion of your toes. But of course, in this case, we're only talking about your big toe. Dorsiflexion is bending backwards. Now, I've done physical therapy on a lot of feet post-bunion surgery, and therefore I know that what some of you are thinking is you want to be able to flex or curl your big toes. Although I understand, I will tell you that flexing or curling your toes is not very important functionally, and certainly not as important as the toe bending backwards. Gripping with your big toe is important for balance, but actually curling or flexing your toe is not very important for function. So let's get back to the one thing that will help you feel the most normal after your bunion surgery: dorsiflexion range of motion. So obviously, this means you have to stretch your toe to bend it backwards. There's a specific way to do this, but first I'm going to tell you the things you should not do. Do not just grab hold and bend your toe backwards. Do not rise up on your toes in order to stretch them backwards. Do not wear flexible shoes in order to stretch them all day, or go barefoot and force your toes to bend with every step. All three of these things will just beat your poor surgical foot up and cause the soreness to persist. As a matter of fact, if you've not been very active, the bones in your foot may not be as strong, and rising up on your toes could actually crack one of the metatarsals. I've seen a lot of things, and this is something I've seen happen. Now, for the correct way to stretch. The key here is that your big toe joint is not just a simple hinge. It also has glide and roll. In order to get the proper motion in your big toe joint after surgery or after injury, you need to restore this glide and roll. Here's how you do it. For those of you in the industry, this little next section is about first-ray mechanics. First, do several distraction or traction stretches. You can see here that I'm pulling out on the toe. You want to grab the whole toe too. You don't want to just grab it from the tip here, because then you'd be distracting this joint. We want to distract this joint. So grab the whole toe and the foot, and then pull straight out. We're going to do several of these distraction or traction stretches because this increases the joint space of the two joint surfaces here. You want joint space because you don't want these two joint surfaces to grind on each other. Chances are this joint's a little bit arthritic because of the malalignment that you had before surgery. If you want me to explain this, just ask or click on the link on the screen to watch the video explanation of that. I'm trying to keep this one short. Second, you distract the big toe and do several glides. In order for the toe to bend backwards, the toe has to glide down with respect to the foot. Again, you're making sure that you grab the entire toe. You don't want to grab it from the tip past this joint. You want to get the whole toe. Make sure you're not on this joint so that you're grabbing behind that joint. Then you're going to distract or put the traction, and then you're going to do your glide. And you're going to do that several times. You can see that we're moving the whole big toe up with respect to this bone right here. And this is again the joint in question. Once you have completed these mobilizations for the accessory joint motions of the big toe joint, then you can move on to the actual dorsiflexion stretch. You're first going to distract, then you're going to glide. While holding this distraction, firmly and slowly bend the big toe back into dorsiflexion. You're going to try to hold this for 30 seconds, or as long as you can if you can't get to 30 seconds. And do this about 5 times. You want to make sure that you have a good stretch. You should also be feeling the stretch on the bottom here. If you feel any sensation, especially like pinching here, then that's actually not doing you any good, because the pinching is just abutment of the joint surfaces. So what you want is a stretch anywhere along the bottom. If you are getting a pinch here, try to regroup, pull a little bit harder for your traction, push a little harder for your glide, and make sure that you're pulling and keeping the traction on that toe for the entire bend back so that it's just stretching on the bottom. It's important to do specific stretching sessions and then wear a stiff-soled shoe to protect the toe throughout the day through the thousands of steps that you're going to take. So you first want to get the proper range of motion, and don't worry, you're going to be able to progress to flexible shoes later. Some of you may have a painful scar. Maybe it's sensitive, maybe it's stuck and feels like you have a piece of tape stuck to you, or maybe you're not tolerating the shoe pressure because your scar is tall and lumpy. These are separate issues with separate treatments. If your scar is sensitive, you will need to go through a process of scar desensitization using desensitization massage. You will start touching and gently rubbing the scar with something that does not hurt and ideally bothers it just a little bit. This may be something soft, maybe it's your bare hands, just something that fits the bill. Rub the scar for several minutes until it no longer bothers you, then stop. Do this several times a day. When the texture of whatever you started with no longer bothers it, move on to something with a little bit more texture and repeat the process. Eventually, you should be able to tolerate a rough towel, loofah, or even AstroTurf. And presto, your scar will no longer be sensitive. Now, even if your scar is years old, if it's sensitive, this technique will work. If your scar is stuck, you will need to do a different type of massage. With this, you will not need any massage lotion. You just want bare dry hands on bare dry skin. But what I would like for you to do is to try right now is to take your right hand and pick up the skin on the back of your left hand. Now let it go. Place your fingers on the back of your hand and move the skin in circles. Do you see how well it moves? This is what skin is supposed to do. This is what you have to try to get the scar to do. So, when the incision is healed, all the different layers of skin fuse together. So you're going to try to pull them apart. You will do just what we did with your hand. You'll lift the skin, pick it up, roll it, and move it around. We have another whole video on scars. If you want more information, give that one a look by clicking the link on your screen. Now, if your scar is tall and lumpy, you will need to use compression and scar massage. The compression is achieved by buying a silica sheet to wear on your scar. You can buy these at drugstores or even something like Target, where we are right now. These strips actually do more than just compression. They create surface tension and also increase the circulation. These products are actually a knockoff on the original Cica Gel. They're the ones who did the research. But if you want to get Cica Gel, you can. You just have to special order it for your pharmacist or find it online. Now your foot might also be swollen. Here are 2 tricks for swelling. The first one is compression. Now you want to use an open-toed compression sock so that the sock doesn't push your toe over. You can also use Coban, but that's a little bit bulky. It's an adhesive wrap. Another thing you can do is contrast bath. For the contrast bath, you'll need a bowl of hot water, like bath water hot, and a bowl of ice water, like with ice cubes in it. I like using a mop bucket for this. You will begin and end with cold. Hold your foot in the cold water for 20 seconds, and then put it in the hot water for 60 seconds. Go back and forth for about 5 cycles. This causes alternating vasodilation and vasoconstriction, which helps pump the fluid out. Another amazing treatment for swelling is called retrograde massage. Now you'll need the help of a physical therapist or a massage therapist in order to do this one, but it does work really great. Some surgeons prescribe physical therapy after bunion surgery and some don't. Some people need physical therapy after bunion surgery and some don't. If you aren't where you want to be, try these tricks, or if you're not too comfortable about doing these things to yourself, come in for therapy. Our doctors of physical therapy do not need a prescription to treat you. Here at BioMechanic, we have therapists who are more experienced than usual at working on bunions and feet in general. So, not any therapist will necessarily know all these techniques either. If you want a professional to help you with this, you don't need a doctor's prescription. Call today and we can help. In Northern Virginia, it's 703-723-7726. In Virginia Beach, it's 757-917-7857. Also, like us on Facebook, check out our YouTube channel, and check out our website.